I'm Dominic Walker, JMW's Inside Man. My guest today is Angharad Hughes. Angharad is a partner in JMW's Clinical Negligence Department. And one of the areas of expertise within the Clinical Negligence Department is around Kernicterus. And it's a phrase that maybe not everybody's heard of, and there isn't a great deal of awareness around either. Angharad, what is Kernicterus?
Of course, Kernicterus is a type of brain damage. Quite commonly, newborn babies or babies in the first few days of life get jaundice, and a lot of the time it's something not to worry about at all. But sometimes the levels of jaundice can get so high that it actually passes the barrier and causes damage to the brain. It's a chemical called bilirubin, and that can pass into the brain and cause a level of brain damage. It can reach a level that's known as hyperbilirubinemia, which is a huge long word to say, but in very straightforward terms means that those levels are so high that it's starting to cause damage to the brain. And we've been trying to raise awareness of it, and it's something that, like you say, isn't very well known because it is quite rare, fortunately, but that knowledge needs to be there because it can have such a huge impact. And we've been trying to raise awareness of it becoming what the NHS term a never event, and that means that, as it sounds, it will never happen. It should never happen, and when it does, processes are in place to report on that, and statistics are raised within the NHS to try and stop that happening, and also that there's training and focus and awareness raising within the medical profession, both for midwives that go out in the community, doctors and neonatal teams in hospitals, and for parents and new families as well.
And you mentioned brain damage, Angharad. Presumably then a baby at such a young age will require support and care right the way through that baby's life. And also the parents would require maybe respite and some help as well.
That's completely right. So if brain damage is caused and hopefully with more awareness raising, these things won't happen quite so much, but if that sadly has occurred, then that child can sometimes have cerebral palsy, hearing loss, impact on their vision, impact on their teeth even, and learning difficulties, and a high level of need for the rest of their life. And that has a huge impact throughout their life on their care needs. It has a huge impact on their family as well, like you say. That they go from being mom and dad, which is already taxing enough, to becoming a carer and having to go to lots of appointments, lots of additional needs, lots of additional therapies required, and that has a huge toll on a parent, a new parent, if they're working, and those needs. So we look to recover for things like additional care, support, therapy, support in school through education, and then more practical things like items of equipment that might enhance, that are aimed to enhance that child's access to independence and access to everything in their lives, and things that even their home may need adapting over the longer term, with the aim really of them living as full a life as possible and being as independent as possible at all stages in their life.
And so for a child who has been brain damaged through poor treatment, how can the Clinical Negligence Department at JMW help?
Well, we're specialists in this field. We've built up over the years a subspecialism in working Kernicterus cases. So we have a real insight into the issues when investigating what's happened, be it an incident in the community where advice has been given to, for example, nurse a baby by a window, and actually there should be tests being done, that baby might need to go back into hospital, or in a hospital setting where the signs of jaundice are there and should be acted upon. So we have access to that wealth of knowledge in looking at the case, assessing the case, getting expert evidence, and then if we're able to prove the case, looking at a full team of expertise to set out and break down what that child needs for the rest of their lives to fulfill their lives and achieve the best possible outcome for them.
And I guess stage one is a conversation with you, Angharad. So you can contact Angharad and the team by emailing insideman@jmw.co.uk or call 0161 82 81 999. I'm Dominic Walker, JMW's Inside Man.